Hello to all of you. Today I want to tell you about edema during pregnancy. Edema during pregnancy occurs as a result of a combination of a number of factors. Conditions that cause edema during pregnancy are as follows. Hormonal changes. During pregnancy, significant changes occur in the hormone levels in the body. Especially the increase in progesterone and estrogen hormones increases fluid retention in the body. In this case, it causes edema during pregnancy. Circulatory system changes. During pregnancy, the volume of blood in the body and the circulatory system increases greatly. This increase causes more retention of fluids in the body. Fluid retention. Fluid retention in the body is a common condition during pregnancy, especially in the last trimesters. The increasing size of the uterus presses on the large vessels under the uterus, affecting blood circulation and causing fluid accumulation in the legs and feet. Salt consumption. Excessive salt consumption can increase fluid retention in the body and thus cause edema. Salt requirement may increase during pregnancy, but it is recommended to avoid excessive salt intake. Prolonged standing or sitting. Prolonged standing or prolonged sitting during pregnancy affects blood circulation in the body and leads to edema. Nutrition, unbalanced nutrition, especially protein deficiency, causes edema during pregnancy. In addition, insufficient fluid intake also contributes to increased edema. When does edema start during pregnancy? Edema during pregnancy often becomes more pronounced in the second half of pregnancy, especially in the last trimesters. Edema is rare during the first trimester. If present, this edema is usually mild. After about the 20th week of pregnancy, especially after the 28th week, edema during pregnancy is common. During pregnancy, edema is more pronounced in the hands, ankles, legs, and face. Edema in these areas can increase, especially later in the day. However, it may decrease in a resting or lying position. Edema in the feet during pregnancy can make itself felt at the end of the day due to prolonged standing. Edema develops in different ways and at different times in different women. Some women experience edema early in their pregnancy, while others experience edema late in their pregnancy. This process is related to the body's adaptation process, to hormonal changes, and increased fluid retention. What are the symptoms of edema during pregnancy? What are the symptoms of edema during pregnancy? Edema during pregnancy usually manifests itself with certain symptoms. Symptoms of edema during pregnancy are as follows. Swelling of the hands, ankles, legs, and face. Weight gain, feeling of squeezing and tightness in the body. Tissues gathered in the legs. The most common symptoms of edema during pregnancy are swelling of the hands, ankles, legs, and face. Edema is usually due to fluid retention in the body. Therefore, a sudden and significant weight gain is an important symptom of edema. In areas affected by edema, there is a feeling of tightness or squeezing of the skin. When wearing shoes or clothes, you may feel more tightening than usual. In addition, edema causes lumps or clumps of tissue to form on the legs and skin. Most of the time, edema is normal during pregnancy. However, especially if there is sudden and excessive edema, it is absolutely necessary to consult a doctor. Where does edema occur during pregnancy? During pregnancy, edema in the body is often seen in areas such as feet, ankles, hands, fingers, legs, and face. These areas swell, especially later in the day or after standing for a long time. While the ankles and feet usually show the first signs of edema, the hands and fingers are also affected by edema. How to prevent edema during pregnancy? How to prevent edema during pregnancy? Edema during pregnancy is not a completely preventable condition. However, excessive edema during pregnancy can be prevented by taking some precautions in this process. Some steps that can be taken to prevent edema during pregnancy are as follows. Balanced nutrition. A balanced and healthy diet helps the body to maintain fluid balance. Reducing the consumption of salt and processed foods also reduces edema. Adequate fluid intake, drinking enough water, helps the body maintain fluid balance and reduces edema. You can facilitate the pregnancy process by trying to drink at least 8-10 glasses of water a day. Regular exercise. Gentle exercise during pregnancy improves circulation and reduces edema. Consider low-impact exercises such as walking, swimming, or specialized yoga for pregnancy. Keeping feet elevated. Keeping the feet in a raised position reduces edema, especially after prolonged sitting or standing. You can use pillows or supports to keep your feet elevated during rest. Taking regular breaks. You should avoid standing or sitting for long periods of time. If you work, it is important to take regular breaks and increase circulation by stretching your legs. Wearing suitable shoes. Wearing comfortable and supportive shoes during pregnancy can reduce edema in the feet during pregnancy. How to eliminate edema. During pregnancy, you can take some measures to deal with edema during pregnancy. First of all, you should take care to drink enough water to avoid edema during pregnancy. Water helps maintain fluid balance in the body and reduce edema. You can also keep edema under control by reducing salt intake, because excess salt increases fluid retention in the body. Doing regular and light exercises for edema relief during pregnancy can also reduce edema by increasing circulation. After standing or sitting for a long time, raising your legs and resting is another method to reduce edema. In addition, applying cold compresses to edematous areas relieves swelling. In addition to all these, eating a healthy diet during pregnancy, consuming fresh fruits, vegetables, and healthy proteins with a balanced diet helps to reduce edema. Finally, getting enough sleep and avoiding stress are also very effective in helping your body cope with edema. What are the foods that cause edema during pregnancy? What are the foods that cause edema during pregnancy? It is necessary to consume certain foods to reduce edema during pregnancy. Foods that can be consumed to relieve edema during pregnancy are as follows: watermelon, cucumber, red chili, kiwi, green tea, mint, lemon water, carrot. In addition to these foods, following a diet program suitable for the person helps to eliminate edema during pregnancy. However, do not neglect to consult your doctor before starting any program during pregnancy. Frequently asked questions about edema during pregnancy. Does edema during pregnancy harm the baby? Mild edema during pregnancy is usually quite normal and does not harm the baby. However, excessive or sudden edema can have serious consequences in some cases and can harm the baby. For this reason, it is very important to be in contact with your doctor during pregnancy. Can edema removers be used during pregnancy? Caution should be exercised in the use of edematous drugs during pregnancy, because any medication or supplement used during pregnancy can potentially harm the health of the expectant mother and the baby. Therefore, the use of edema-relieving drugs during pregnancy should only be with the advice or approval of your doctor. Can lemon water be consumed to remove edema during pregnancy? Consuming lemon water during pregnancy helps cleanse and hydrate the body. Lemon water strengthens the immune system and supports digestion thanks to the vitamin C and antioxidants contained in lemon. How to remove edema in the body during pregnancy. There are several ways to reduce edema in the body during pregnancy. Firstly, it is important to drink plenty of water. Ironically, drinking more water helps to reduce fluid retention in the body. At this point, it is also important to keep salt intake under control, because salt can increase fluid retention. Regular exercise can also reduce edema by increasing circulation. How to remove edema in the legs during pregnancy. One of the effective ways to reduce edema in the legs is regular and light exercise. Low-impact exercises such as walking, swimming, or special yoga for pregnant women can improve circulation and reduce edema in the legs. Thanks for watching.